All right, everybody. I'm Dr. Ashley. Nice to see you again. And this is Thea from Equipped to Flourish. And we are doing our interview series of other providers who help in our community resources for our moms and families. And so we are going to kind of highlight what she does in the lactation world. And we'll let her tell you a little more about exactly what she does.
Yeah, so thanks for having me today.
Absolutely.
I love meeting with other providers and getting more support for the parents that we support. So thank you so much for having me.
Of course.
So I co-own a lactation company with my sister. I have two sisters. One of them owns the company with me. Together we have 7 kids with all 3 of us between the ages of 8 and 6 months. And so we have been through all of the challenges of lactation and pumping and nursing, and we're like, there's just a huge gap here of care that we're seeing. And I've been in lactation professionally for the last 7 years. I have worked in a clinic base. I've also worked in-home. I'm also a certified postpartum doula, so I know what kind of care, this diet needs, both mom and baby. And when I worked in clinic, I was seeing lots of crisis, put out fire, put out fire, put out fire, put out fire, which is great. Obviously we want to help these parents, but as a doula, I realized if I can see you prenatally and walk you through this whole period, and we have consistency and a trust relationship that you feel you can come to me, we don't have these huge spikes of
no big crisis,
right?
right?
No.
Yeah.
I mean, yes, there will be hard times, and yes, maybe we could find a crisis, but it's not going to be the same as if you didn't have the support going in. You know where you can go. You know that we are a team and we will take care of it together. So Rain and I started Equipped to Flourish last year, and it's this model of lactation that's very different from anything else out there. So most of the time you have clinical visits, which are great. We love clinical visits, but they're often in the hospital and then maybe a couple other times when you're in that crisis mode. But for us, we want to use lactation as the catalyst to care for you and your infant. And so in this early period, you're mostly nursing or pumping, whichever you're doing takes up the lion's share of your day. So if we can make that good and make sure we're looking at your mental health and your physical health and how's your infant doing and how are they growing, we can take care of you together to make sure you're thriving and not just hoping to make it through to the next feeding.
Somewhat surviving, right?
Yeah, and
just surviving.
Yeah,
yes.
Definitely.
Mm-hmm. Yes.
So that's why we started our lactation company, to hopefully make these situations better so that we can have you in a place where you are happy and enjoying this process and being able to spend the time presently bonding with your infant versus just let's make it through the next one. I'm in pain, but we'll make it.
And mental health is really affected by how well that feeding process goes. Just as a mom myself, I know when you're not able to feed the way that you expect to be able to, it feels almost like a failure. This is my one job this postpartum period, and it's not, but sometimes that's how we can internalize that. And if we're not able to feed them like we wanted to or expected to, or it's really painful, I can do it, I have the supply and baby's able to latch on, but it hurts really bad and is really uncomfortable, it just makes you feel like you're failing. And it feels like everybody else, every other mom in the world can do this. We don't talk enough about the moms that I see in practice. I would say the high majority have some kind of challenge, from very, very mild challenges to way more big challenges, right? Failure to thrive, this isn't working, my supply isn't happening, or baby's not able to get what they need, right? But we talk about, are we gonna breast or bottle feed? Not, okay, then once we get there, what does that process look like and what can our challenges be on both ends? Yeah. With breastfeeding, it's the process itself and are we getting what baby needs? And in that bottle feeding world, it's, are they going to do okay with that formula? Are they going to get what they need? Are they allergic or sensitive or have problems with those kind of things too? So being able to talk to moms and say, no, you're more likely to have to work at this process to get it perfect than to say, oh, you're breastfeeding great, you're okay. Right? There's just more to it than that.
There's so much more. And it seems like it's natural. People have been doing this since there were people, which is totally true. But if you think about it, humans are meant to live in community, and they're meant to have all of these people around them, all of your aunties, all of the wise women around you who are helping you during this time, physically helping you and bringing you food and, no, this is how you do this. But there's still problems even in those spaces, and you need people to help you. Today, we don't have that community as much, and so we still need people to come around us and help us do it because, well, maybe a natural process, that doesn't mean it's an easy process.
Nope.
Just like anything else, like you don't just hop on the highway the first time you drive a car. Like, that's not gonna work.
Right.
So, and every baby's different. So what may have worked with your first child really well may not happen with your second or your fifth. Like, it's totally different experience every time. And so making sure that you have the support of someone who is looking at all of these things and looking at you holistically to help you get there is really important.
Huge. Like, absolutely huge. Yeah. Anything else about, just kind of tell me what made you want to do this? What is your why? What brought you into the lactation world?
Yeah, so lactation is not my first career.
Okay.
I have a background in teaching, in art and history, and I actually was getting my master's in walking when I was like super pregnant with our first. And then we had an emergency C-section, extensive NICU stay, not at all what we had planned on, and so lots and lots of problems. Really intensive postpartum depression, which is why I'm so passionate about mental health for parents. So I had my mom drive me to lactation like quite frequently, and she would drive me off and be like, you have to take care of this because you want to breastfeed, this is what you want to do. And I'm like, okay. So I exclusively pumped for both of my kids for various periods of time due to health reasons, and then also nursed them. And I fell in with a great community who was really supportive, and I was like, I love this time period. I love helping these families, and so someone was like, you should look into doing this, and so I did, and here we are, almost 8 years later, helping families and knowing from a personal level, but also I've seen hundreds of families through this process and know what it's like to be like, it's not gone the way we want. We don't know what to do. The mom guilt is so high.
Oh, so yes.
And you think everything you're doing is wrong. To be able to support those families and be like, we can help you from where you are here and get you to a really good place. And there's a huge gap of care for what you receive in the hospital or from your midwife at your home birth to the next time you see them, which can be 6 weeks for a mom. A lot can happen in that time, and infants can change from feeding to feeding and day to day, and you need someone that will walk with you through each of those steps and help you troubleshoot and make a plan for each of those moments.
I love that. It's super huge, like you said, that we were meant to be in a village or a community where we all support each other, and not just one aspect of health or support or family. There's so many pieces that really are meant to be there, and unfortunately most of us just don't have that type of community anymore. And so to help kind of fill in those gaps and to know that you're not alone, you're not the only one that this is a challenge for, right? Because it does feel like that, especially if we do start having some of that big mom guilt that turns into more of the postpartum depression or postpartum anxiety and big stress and overwhelm. And that's not healthy for you or baby. And so to be able to have someone come around and say, no, this is completely normal, and we do have strategies and tips and tools and a way to do this, and we learned all of this for a reason, right? Because we're supposed to be able to support these moms. So I love that you take it from like that community and village kind of perspective and look holistically. You're looking at, and that's why I love working with other providers like community-wise, because if you see someone who I see a lot more restriction, or we're having a lot of trouble more torticollis, or we're not turning our head very well to one side, and so it's not comfortable to eat that way, or we're not able to open airway and feeding when we're turning that way, you make sure that you have the right resources to send mom to for those pieces of it, so we're not lacking in any of the other areas as well. And that's the same thing we kind of do, is we make sure, okay, we do our part neurologically, right? But does that kiddo need lactation? Do they need a pediatric dentist? Do they need OT or speech or myofascial therapy for what's going on with things? So it's awesome that you look at mom and say, okay, I get to come into your world and I get to see a little more into what's going on, because that breastfeeding journey, or even bottle feeding, depending on where we are, really kind of comes into home. And we talk about what all is going on, you know, even over and above just the feeding part. Where else are we kind of having gaps or need spaces filled by things, and where we can plug in those gaps are super huge.
Yeah.
So that's awesome.
Definitely. And I think we do the things that we do really well, but we can never do all of these things, and I wouldn't want to do all of these things.
No, because you couldn't be great at all those things,
you
right?
At all these other things.
Yes.
I want to send you to the person that is going to be what you need in this space.
Yes.
And we work totally virtually, which is something that you may think, oh, you can't do lactation help virtually because you have to like be there hands-on. And I've done hands-on. I did hands-on for many, many years. But what I found with virtual lactation is we can do almost everything virtually that I can do hands-on. But you're still going to need those providers who do get hands-on and get in your infant's mouth and do stretches. And there's that place for it. But also virtually, one of the things that I found to be really beneficial is I can come into your house and latch almost any baby. I won't say I can latch every single baby, but like 95% of those babies, I can latch on you, no problem. But that doesn't mean that the mom can latch that baby when I'm gone. And so when we work virtually, since I can't touch you, I have to make sure that I'm telling you exactly what to do and teaching you to latch the baby yourself so that when we're not on the phone together, you have a much higher rate of latching your own baby, which I think is actually a really good thing because you are learning those skills a lot more quickly rather than me helping you do it. And so I think that's really important. And also with virtual care, we can do a lot of other things that's not solely latch. So we specify in pumping also, and so we can do all of your pumping stuff and we can walk you through all your pump parts virtually, and you don't have to schlep them all in with you when you come. We can do your sizing virtually. We also have like weekly check-ins and mental health check-ins that come to you in your inbox and then can give us a lot of information when we meet with you. So I think those things can be really helpful.
A lot of support, even with it being virtual. And sometimes, I mean, there's a lot of times a mom's like, I don't care, come in and help just the best way you can. Sometimes it's like, I'd rather not have to have someone coming in, whether it's during COVID. We obviously wanted less physical interaction with the least amount of people, especially with a new baby, right? And some families feel that way even without it being COVID or anything in particular, right? Just sometimes we'd rather not have to have as much interaction with people that could have anything from the outside world, right? And so sometimes I have a set up space that I feel super comfortable. I have other kids. I have a husband that is not the least messy person in the world. And so I don't have to worry about and you shouldn't have to worry anyway. And all of us providers are like, that is not something for you to worry about.
Don't look at my house.
Yes,
and
never,
right?
Never worry about it. But sometimes just us, especially postpartum, we feel like we can't do all of those things. And so that feels like another difficult challenge. And so sometimes virtual kind of lets you not have to worry about a lot of those things. And like, okay, in this space, in my bed, in the space where I mostly feed, whether it's a chair or a bed or a couch or wherever you're most comfortable, you can kind of be in those places and you're able to see them in the comfort of their own home and where they do those things, not in a clinic, right? And then also not necessarily have to be in that space as well and give them all the tools that, like you said, when you leave, if you've gotten everything perfect, baby's coming off, right? They're not going to stay feeding. So when they come off and we go to feed again and it's like, oh man, I can't do what she did, right? And so if they did what you said to do, they've already done it. They're not having to figure it out when you're gone. So there's some awesome things about virtual too. And so I think it's nice to have all the different options for moms so they know exactly what fits them is what we have available.
Yeah, I think that's good. And you don't have to drive. For moms with newly C-section, like you can't drive right away.
Right.
So
and carry all the stuff, right? Like the strollers or the car seats or the bags. I was like, how does such a tiny thing require so much stuff? And so you feel like you need to take all of those things everywhere you go, and it makes sense. We need a lot of things. But to not have to worry about it, you're literally in the comfort of home where all those things just live. It's kind of convenient and nice to not have to take that into a clinic setting. And same thing with clinic. A lot of people might be in that space, right? And so we might not want baby introduced to that many people at one time right away too, especially really early on. So lots of convenient things about virtual.
For sure. And it's also about the connection that you have with the provider. One of the reasons we do lots of prenatal work is because coming into lactation is a very personal and like vulnerable place to be. And I want you to feel comfortable with me, and if I'm not your jam, like there are other awesome people. Find the person that is your jam that you connect with really well, because for this relationship to work and for you to be successful, we have to have trust. We have to have a place that we're already in a good relationship to build off of.
100%. So, if somebody wants to work with you, if they want more information about what you do or how it works, what's the best way to find out more or connect with you?
Yeah, for sure. So we are on social media. So we're on Facebook and Instagram. We have a website. You can contact us in all of those ways. For your clients, you just connect us with them. But ideally, we're seeing you prenatally because almost all the parents that we have had this career before, and you work really hard for your career. You don't just like jump in day one and you're like, I'll learn it on the fly.
Yeah.
Like you have practicum and you have tests and you have boards and all these things, and coming into caring for an infant and nursing, we want to prep you in that same way so that you feel good about going in. And so I think prenatal education is really, really important. And plus, I find that for parents, it like lowers their anxiety level because they're like, okay, I know what to expect. I have some tools already in my bag that I can do. So that's really good. Plus, we help you pick out your pump. We get you an early fitting. So if you would pump or you're planning to exclusively pump, that's ready to go. And we have a good relationship. But we do help parents who are later, you're in crisis. We're ready to help you in crisis. Everything we do is package-based because I know that I'm going to give you the best care if I see you continually, and I can't, in good conscience as a provider, say, I helped you this one time, go into the world, and everything will be fine. So that way, we're working together, we have this relationship, and it's so much more than just latching. Like, there's all these other things. So, can we do that continually?
Yeah, that's fantastic. I love that. And we will also have everything in the description, in the comments. We'll have every way to contact you through website, through social media, all of those things. So it was great to be able to connect with you and learn more about what you do and why, and where your system kind of works with what kind of moms and families and all of those things. So awesome. Thank you for working with all these amazing moms and sharing your story too. Because I mean, that's huge. And moms saying, oh my gosh, it matches what I went through. And being vulnerable and saying, I had some postpartum depression and that affected my journey, right?
For sure.
And it opens up the space for moms to be able to say, I can tell her how I really feel, right? And not feel scared or embarrassed or like I shouldn't feel like this. No, really, we have all of those feelings postpartum, and there's not a wrong feeling. There's not a wrong, I mean, there's just, it is a big experience, like you said. Mom and baby just went through a huge prenatal time that is not your normal, a huge birth process, no matter how that looked. And so how we feel and how we process and how we're balanced is just not always our normal self and our good, perfect, normal way that we operate in the world. So to feel safe, to be able to say, no, this is what I'm feeling. Are there things that I need to do? Are there other resources? Or this breastfeeding journey is why I'm feeling like this. If I can just get help, I'll feel so much better and like I'm doing what I wanted to do and how I plan to do it. So,
and be in a sustainable place.
Yes.
If we can't get you in a sustainable place, it's not going to matter what's happening.
Right. Yes.
So.
All right. Thank you so much. And I will have all those things listed for moms and families to be able to contact you.
Thank you so much.
Thanks, guys. We'll see you next time.